Dr. Hankir is an academic clinical fellow in psychiatry at King's College London and a senior research fellow with the Centre for Mental Health Research with Cambridge University. Dr. Hankir founded The Wounded Healer, which is a program that aims to blend psychiatry with performing arts, where Dr. Hankir has been to deliver The Wounded Healer to 19 different countries. His interests include global and Muslim mental health and evaluating programs that aim to challenge stigma around mental health. And it is great to have you joining us again. So thank you so much.
You are very welcome, Tori. I think it is working. You can see my slides, I hope, and yes, you can hear me and see me?
Yes, perfect.
A massive thank you to you, Tori, and the Educate committee. I'm a huge fan of Educate, and congratulations also. You've recently received at least one award, if I'm not mistaken, so I'm not surprised in the slightest and thoroughly deserved. Okay, so this is the title of my presentation, Canaries in a Coal Mine, Islamophobia and Muslim Mental Health. So, in this talk, I'm going to define Islamophobia and present research on its egregious effects, not only on Muslim mental health, because as will be revealed, you don't have to be Muslim to be the victim of Islamophobia. Islamophobia has become racialized. So not just Muslim mental health, but the mental health of those also who are perceived as Muslim. Highlight the structural inequalities that exist in British society for people from Black, Asian, and minority ethnic, henceforth referred to as BAME backgrounds, or if you're in the US, apparently it's BIPOC, isn't it? It's Black, Indigenous, and people of color. And discuss and describe innovative ways to challenge Islamophobia and illustrate how Islamophobia has stealthily infiltrated a mental health care policy and provision through the guise of the controversial PREVENT program in the UK. Okay, so much of the material in this presentation was extracted from this textbook, which I was fortunate to co-edit with Professor Rania Awad at Stanford University. And Professor Awad presented her research findings on Muslim mental health to Barack Obama at the White House. So she really is, well, arguably the world authority in the field of Muslim mental health. So I highly recommend that you read content that she creates. And I certainly learned a lot from her. The other editors, for your information, so John Petit's at Harvard, and he's a Christian, and Stephen Mofick is he's a Jewish man, and he's based in Milwaukee. And the point we're making is that we need to have this kind of multi-faith approach to challenging not only Islamophobia but other forms of religious hate crime, for example, anti-Semitism. So I want to share an anecdote with you all to illustrate just how insidious and pervasive a phenomenon Islamophobia is, and how deeply entrenched this type of racism is in the fabric of British society. So following the heinous and horrific terror attack perpetrated against the LGBTQ plus community in a nightclub in Orlando, Pulse nightclub, there was a spike, unsurprisingly, in anti-Muslim hate crime. And I was invited to deliver a keynote lecture about challenging Islamophobia. So there I was in Manchester Airport, and I was randomly selected for a further security check. And I noticed a fellow Muslim traveler, albeit he was clad in traditional Islamic attire. He had this really kind of broad smile on his face, and he was exuding serenity. He was really friendly and helpful. However, despite this, I started to notice the following. My heart was racing, and I had some shortness of breath and this choking sensation in my throat, and my palms were moist, and I was experiencing a panic attack, and I felt so ashamed. Oh my God, or should I say, oh my Allah. I have been the victim of Islamophobia, and there I was. I was being a source of Islamophobia. Now, if that's how I felt in that scenario, then how do non-Muslims feel? Okay, so let's start off by defining Islamophobia. So it's been defined as an exaggerated, irrational fear, hatred, and hostility towards Islam and Muslims perpetuated by negative stereotypes, resulting in bias, discrimination, and marginalization of Muslims from civic, social, and political life. Now, I think this definition is rather helpful because it captures to an extent how Islamophobia is more than just a fear reaction, as denoted by the term phobia. Now, the all-party parliamentary group on British Muslims, they convened and they formulated the following working definition of Islamophobia. So, Islamophobia is rooted in racism and is a type of racism that targets expressions of Muslimness or perceived Muslimness. So to emphasize, you don't have to be Muslim to be the victim of Islamophobia, because Islamophobia has become racialized. Many members of the Sikh community, for example, report that they are the victim of Islamophobia. Now, some people find this confusing. That is, how can Islamophobia be rooted in racism when Islam is a religion? So I want to invite you to participate in a mental experiment with me. So please close your eyes and try to imagine what a terrorist might look like. Okay. Now, please open your eyes now. And how many of you thought of someone who looks like this? Oh, can you see that? Oh, there he is. How many of you thought of someone who looked like this? Be honest. And how many of you imagined someone who perhaps looks something like this, or at least has the same skin complexion? The point I'm making is Islamophobia has become racialized, and the crude association between being brown and Muslim and being a terrorist is often made. And this is none other than Riz Ahmed, who was recently, if I'm not mistaken, nominated for an Oscar in a film. I forget the name of the film, but I think it was an outstanding performance. And he's a British Muslim Emmy Award-winning actor, and he vociferously campaigns against Islamophobia, and he takes full advantage of his celebrity status to do so. And in 2007, Riz was included in Time magazine's 100 most influential people list. So the picture not the picture of him in Time magazine, the other one, that was taken from the TV series In the Night Of. And I would highly recommend, if you feel like binging on Netflix, I would highly recommend you watch that film. It's all about the protagonist who is accused of killing this wealthy white American lady, and this was like after 9/11. So I thought it would give you like a really powerful insight into Islamophobia in the US. So we know that negative portrayals of Muslims and Islam in the media and popular culture and film can propagate and perpetuate caricatures, negative stereotypes and tropes of Muslims and Islamophobia. And this is none other than Ahmed, the dead terrorist. There he is, the ventriloquist. He is the brainchild of Jeff Dunham. Apparently, I think it went viral, this kind of YouTube clip. And this does I mean, I think it's quite funny actually, but I mean, people, I can imagine many people find it quite offensive, but obviously perpetuates these kind of caricatures of Muslims. So the Riz test, which was named after the actor Riz Ahmed, was conceived to assess if the portrayal of Muslims on our screens propagates and perpetuates Islamophobia, and it can be administered by asking the following 5 questions. If the film show stars at least one character who is identifiably a Muslim by ethnicity, language, or clothing, is the character 1 talking about the victim of or the perpetrator of terrorism? 2, presented as irrationally angry. 3, presented as superstitious, culturally backwards, or anti-modern. 4, presented as a threat to a Western way of life. And you may have often heard about this. Are you Muslim first or are you British first? As if the two are dichotomous. And 4, if male, is he presented as misogynistic? And if female, is she presented as oppressed? And if the answer for any of the above is yes, then the film, TV show fails the Riz test and is likely culpable of propagating and perpetuating Islamophobia on our screens. Now, perceptions of Muslims are strongly influenced by how we are portrayed in the media. And Professor Paul Baker and colleagues at Lancaster University, they used computer software technology to analyze over 200,000 newspaper articles written about Islam and Muslims between 1998 and 2000. And the researchers revealed that for every one positive word describing Islam and Muslims, there were a staggering 21 negative words. For every one positive word describing Muslims and Islam, there were a staggering 21 negative words. And is it any wonder that when I was in the airports, that I developed a panic attack when I saw the Muslim traveler? Because our perceptions are being bombarded and assaulted by these negative kind of descriptions of Islam and Muslims. Right. How does the media report terrorism? So I think it very much depends on the background of the perpetrator. So this is Darren Osborne, the terrorist behind the 2017 Finsbury Park Mosque attack in North London. And he was initially described by the media as a jobless lone wolf and a father who had mental health problems. And I think this language, they are framing the perpetrator as if he is the victim. Wait a second. Are you thinking what I'm thinking? Well, my mind works in mysterious ways, so we'll find out. Is that what you were thinking? That's what I was thinking. Now, although this picture may be comical, many would argue there is some truth imbued in it. I was about to mention it. There we go. I thought, yeah, great minds think alike. So, the demonization and the vilification of Muslims by demagogues and segments of the media, and the rise of radicalization, populism, and isolationism have all colluded and conspired to heighten levels of Islamophobia in the West. So any movie aficionados in the audience, who is this charismatic, who is this charismatic chap exuding panache? Anyone know? Atticus Finch. Thank you, Harry. Thank you very much. You can be my partner in crime, Harry. So here we have Gregory Peck, who garnered an Oscar for his portrayal of Atticus Finch in the adaptation of Harper Lee's novel To Kill a Mockingbird. So when I'm teaching medical students about the mental state examination, and when you're, for example, reviewing a patient who might be in a crisis situation, hearing voices, suicidal, in order for us to be empathetic, then we have to be able to put ourselves in their shoes and walk around in them. And that's a quote from Atticus Finch. Put yourself in that person's shoes. What's it like for that person receiving care from you? What's it like to be in a crisis situation? What's it like to hear voices? And you need to try to imagine what that must be like. Put yourself in their shoes, walk around in them. What's it like to be a Black person in the United States, for example? So Channel 4's documentary, My Week as a Muslim, features Katie Freeman. She is a quintessential British mum from a provincial town in rural England that has a negligible Muslim community. So Katie decides to pretend that she is a Muslim, and you can see her on your right wearing the hijab and traditional Islamic attire. And she lives with a Muslim family in Manchester for a week. Now, it just so happened that the program coincided with the heinous and the horrific terror attack in Manchester. And Katie experiences firsthand the toxic effects of Islamophobia when clad in a burqa. She passes by a pub in her hometown, and people hurl words of abuse towards her and even ask her if she plotted to blow them all up. And Katie was visibly distraught and distressed when she was describing the ordeal to viewers afterwards. Now, Professor Sir Simon Wesley at the IOPPN at King's College London, he published a paper in the BMJ entitled The Psychological and the Behavioral Reactions to the Bombings in London on the 7th of July 2005. And the aim was to assess the impact of these 7/7 bombings on stress levels and travel intentions in London's population. And the outcome measures they used were the presence of substantial stress and intention to travel less on public transportation or into central London. And they also used the same tool that measured the emotional impact of 9/11 on the US population. And they revealed that being Muslim was associated with a greater presence of substantial stress. And they hypothesized that it was the fear of backlash that was a factor that contributed to their findings. So my friend, my mate, Jonas Kunst, he's a professor of psychology at the University of Oslo, and they developed and they validated the perceived Islamophobia scale, and they recruited over 1,300 participants, all Muslim, throughout Europe, Germany, the UK, and France. And they revealed that the perceived Islamophobia scale was positively related to psychological distress in their sample. So there's evidence to prove that Islamophobia is associated with psychological distress. And they concluded that anti-discrimination laws may be insufficient at protecting Muslims against the adverse effects of stigma on psychological well-being. In other words, there are loopholes in the legislation that allows Islamophobia to flourish in the UK, and consequently, this has adverse effects on the mental health and psychological well-being of Muslims and those perceived as Muslim. So let's focus on the anti-discrimination laws in the UK with regards to religious and race hate crimes, because there's a clear and important distinction between the two. Now, this is a comment from Eric Kitson, who was the former UKIP councillor for Stourport in Worcestershire, and he was investigated over these comments and cartoons posted on his Facebook page, which showed of a Muslim being spit roasted on a fire, fueled by copies of the Holy Quran. And a further post relating to Muslim women with the caption, "Hang 'em all first, then ask questions later." Who thinks that this vulgar comment is illegal? Who thinks this is against the law and that Eric was held accountable for committing a crime? Does anyone think, maybe a show of hands, anyone think that this is illegal? Oh, thank you. Yeah. Oh, there's quite a few. Can you see? Team? Right. Okay. I mean, it's disgusting, isn't it? It's just, it makes me want to vomit. You know, people who, oh, I think it's against the law, but prosecution is another matter. Thank you, Jake. Thank you very much. Well, let's explore further, shall we? Let's delve deeper, shall we? So, with regards to legislation in the UK, there is a clear distinction between anti-race hate crime and anti-religion hate crime. So Sikhism and Judaism are classed as a race in the UK, whereas Islam isn't. You can't insult, abuse, or use violent or threatening words against someone based on their race. But you can on their religion if you can't prove that they had the intention to incite racial or religious hatred. What does that mean? Okay, so for example, you can say, I want to kill all these Muslims, and then claim you didn't mean it, that you were merely exercising your freedom of speech. But you can't say the same about Sikhs or Jews. So this goes back to what my friend Jonas Kunst was saying, that there are loopholes in the legislation that allows Islamophobia to flourish. The anti-discrimination laws may be insufficient at protecting Muslims against the adverse effects of stigma on psychological well-being. Now, no talk on Islamophobia would be complete without reference to the atrocities that occurred in New Zealand on the 15th of March 2019. A terrorist opened fire on Muslim worshippers at Al Noor Mosque and Linwood Islamic Center in Christchurch, callously murdering 51 people. I used to work in New Zealand as a psychiatric registrar, and I prayed alongside many of the people who were massacred. My shoulders touched their shoulders, my feet touched their feet. And on the day I discovered the attack took place, I was giving a talk at the Royal College of Psychiatrists event in York, in the UK. And I, like a multitude of people throughout the world, Muslim and non-Muslim alike, I was absolutely distraught. And I experienced psychological distress. I don't care if this shatters my masculine bravado. I did cry inconsolably. Anyway, we need to rewrite what it means to be strong. I get really emotional when I talk about this. These are human beings. We are human beings. And we were murdered in that mosque on that dark day. Children, women, killed. In 2019, I co-organized the inaugural Global Muslim Mental Health Conference in Cambridge University under the auspices of Michigan State University. And we were fortunate to host Bahia Ahmed Darwish, a Muslim American who traveled to New Zealand to provide therapy to the people affected by the Christchurch mosque terror attack. And this is Ma'af. At 3 years of age, he was the youngest person killed at the Christchurch mosque terror attack. And Ma'af's mother met Bahia and asked her to share Ma'af's story with the world. And Bahia promised that she would. And I promised Bahia that I would. Ma'af was 3 years old. And the judge, when he was speaking with the perpetrator, when the perpetrator was, I think, was being prosecuted, he referred to this case because Ma'af was holding his father's leg in broad daylight, and the perpetrator shot him in the head in point blank range. Islamophobia is lethal. It is deadly. Let there be no ambiguity about that. And now Ma'af, we believe, Muslims believe he is watching over us. He's an angel. He's just a boy. The personification of innocence. What did he do wrong? What did Ma'af do wrong? So in December 2019, the New Zealand government contacted me and they asked me if I could review this proposal for 700,000 New Zealand dollars to conduct research on the psychological effects of the March 15 terror attacks. And I'm pleased to say that the funding was authorized and empirical research will be conducted that will generate data to provide us with a deeper understanding of the impact this atrocity continues to have on the mental health of the people who were in the mosques at the time and the first degree relatives and spouses of those who were tragically killed. And these are some of the take-home messages. Right. So an independent review into the treatment and outcomes for BAME individuals in the criminal justice system was conducted. This is called the LAMI review, because we know that people from BAME backgrounds are not only overrepresented in the criminal justice system, but also in mental health care services. You are more likely to be detained under the Mental Health Act if you're from a BAME background. You are more likely to be diagnosed with schizophrenia if you're from a BAME background. You're more likely to receive psychiatric drugs and less likely to receive talking therapy if you're from a BAME background. This is racism in the provision of mental health care. And the Royal College of Psychiatrists is not oblivious to this. The President, Dr. Adrian James, knows about this. He's appointed racial equality leads to address this. 6 out of 10 BAME psychiatrists report that they are the victim of racism. So it's not only the patients, it's the providers as well. So according to the LAMA review, 15% of the prison inmates are Muslim, yet represent less than 5% of the population. So Muslims are overrepresented in the criminal justice system. And this is a scintillating article about the overrepresentation of Muslims in the criminal justice system. And this is good old David Lammy looking perplexed. And he said, we simply do not know why Muslims are overrepresented in prison. And this article, the author is Suhaima Munzir Khan, very active in social media, also known as the Brown Hijabi. I'm going to quote her verbatim. No worries, Lammy and co. I have a few ideas that might explain how a population depicted as suspicious and criminal in Britain could end up being overrepresented in prison, exclamation mark. Okay, so the layers of disadvantage for Muslims in Great Britain. 46%, almost 50% of us live in the 10% most deprived local authority districts in Britain today. Poverty impacts access to resources, school attainment, employment opportunities, and the likelihood of involvement in crime and therefore incarceration. And Muslims are often ethnic minorities and are consistently stereotyped as criminals and terrorists. And such realities create intergenerational cycles where people cannot accumulate enough economic or social capital to break out of poverty. So this is another comment from the Brown Hijabi. If you keep a population poor, deny them opportunities to educationally or financially exit that poverty, ignore structural inequality, racially profile us, and tell the rest of the population to be suspicious of us, then there's your answer. That's why we are overrepresented in the criminal justice system. This is a really fascinating study conducted by Dr. James Cheshire at UCL, entitled Lives on the Line, which illustrates the social determinants of health. So for every station stop from Lancaster Gate to Mile End, traveling eastbound on the Circle Line, life expectancy decreased by 1 year. Can you believe that? Isn't that astonishing? So if you go to a relatively affluent part, Lancaster Gate, for example, and by the time you've arrived in Mile End, which has a dense Muslim population where unemployment and poverty are massive concerns, your life expectancy has decreased by 12 years. This is the UK, a developed nation. So this is another really powerful article in The Guardian from Kamran Ahmed, who, by the way, is Ahmed's brother. Kamran Ahmed is a consultant psychiatrist. He trained at the Maudsley, but he's based in Sydney now. Why do some young people become jihadis? And Dr. Ahmed contends that psychiatry offers answers. So many second-generation Muslims, they can experience like an identity crisis, and they might feel like they're too Eastern to be Western and too Western to be Eastern, and they can't. They want to integrate with society, but despite their best efforts, they are socially excluded, and that can make them vulnerable. That's the hypothesis. And these disaffected Muslims, for them, a sense of belonging becomes an appealing option. They really want to feel like they belong, like we belong. In this case, their minds become fertile ground for radicalization. This is the hypothesis. So this is some idiots, I will call him an idiot, referred to as Brother Abu Bara al-Hindi, who argues that he knows what it feels like for Western Muslims, and that the cure for depression is jihad, which obviously is complete and utter nonsense. So I guess the point I'm making is that with all of this Islamophobia, it can be very depressing. Muslims are overrepresented in the criminal justice system. 50% of Muslims live in the 10% most deprived local authorities in the UK. We are socially excluded. We are experiencing an identity crisis. We yearn to integrate with others, and yet despite our best efforts, we are ostracized and marginalized and dehumanized. And that's going to all be very depressing. Now, this is an MI5 report which challenges views on terrorism in the UK. And far from being Islamist fundamentalists, most terrorists are religious novices and do not practice the faith regularly. Some are involved in drug taking, drinking alcohol, and visiting brothels, all haram, prohibited in Islam. And the MI5 reports that there is evidence that a well-established religious identity actually confers protection against violent radicalization. And obviously, in the Quran, you may have heard of this before. If you kill one human being, it is as if you killed the whole of humankind. And if you save a life, it is as if you've saved all of humankind. And this is the same verse. This is the motto of the Syrian Civil Defense, also known as the White Helmets. And it's an organization comprised of volunteers who carry out medical evacuation and urban search and rescue in response to bombing in Syria. We know there's a revolution in Syria. And The White Helmets is also the title of the 2016 British short documentary film. I should have actually asked you to make a list and because I'm recommending all of these films to you. So this is the documentary, The White Helmets. It got 100% on Rotten Tomatoes, and it garnered an Oscar for Best Documentary, the short subject, at the 89th Academy Awards. So the motto of the Syrian Civil Defense, also known as the White Helmets, is to save a life, is to save all of humanity, and that was extracted from the Holy Quran, which Muslims believe to be the infallible word of God. Right, okay, final stretch. Challenging Islamophobia. This is a bystander's guide to helping a person who is being targeted. This is in in the context of public transportation. This is from the city of Boston. And so people ask me, what can you do as an individual at the level of the individual? So if you're all active on social media, and you should be, because to quote Dylan Thomas, do not go gentle into that good night, but tweet against the dying of the light. We need to harness the power of digital technology to challenge Islamophobia. Find this TED Talk by Dalia Mujahid and share it. And Dalia Mujahid says that Muslims are like canaries in a coal mine. Although we are the first to feel it, the toxic fumes of fear are harming us all. And how can I not mention Mohammed Salah when talking about challenging Islamophobia? Any Liverpool, any LFC fans in the audience today? Can I get a show of hands? Can I get a hoo-ha? Sergeant? No? Oh, right, okay. Oh, we have a few. Yeah, we've got a few. Boo. Oh, Tory. Oh, do you support? Are you? Oh, wonderful. Okay. So, and hopefully they'll make it. I think they'll make it to the to the Champions League qualification. I think I'm optimistic. So Mo Salah plays as a forward for LFC, and he is regarded as one of the best footballers on the planet. And whenever he would score a goal, he would celebrate by performing the sujood. And that's when you place your forehead on the ground, as you can see in this picture. And so emblematic is Salah's sujood that the celebration is included in the video game FIFA 2019, played by millions throughout the world. So in February 2018, LFC fans celebrated a decisive away win over FC Porto in the Champions League. And they started to chant the following in unison: if he's good enough for you, he's good enough for me. If he scores another few, then I'll be a Muslim too. If he's good enough for you, he's good enough for me, then sitting in the mosque is where I want to be. Now, I know what you're thinking. Don't give up your day job, Dr. Hankir. I won't. Probably a terrible rendition, I know. But the point I'm making is, this is a far cry from the racist hooliganism that we're all too familiar with. Then sitting in a mosque is where I want to be. I didn't think I would ever hear Liverpool fans. Not that there are no Muslims who are Liverpool fans, but I think you know what I mean. So this is a report from the Immigration Policy Lab at Stanford University. It's entitled, "Can Exposure to Celebrities Reduce Prejudice? The Effect of Mohammed Salah on Islamophobic Behaviors." It's called the Salah Effect. And the causal effect of Salah joining LFC on Islamophobia was revealed using 936 county-month hate crime observations and 15 million tweets from UK football fans. And the Merseyside county experienced a 20% drop in hate crimes relative to a synthetic control, while no similar effect was found for other types of crime. And LFC fans halved their rates of posting anti-Muslim tweets relative to fans of other top-flight English football clubs. And you can see in this graph, on the y-axis, it's the percentage of respondents endorsing the statement that Islam clashes with British values. And on the x-axis, you can see the year. And so from 2015 to 2017, there was a rise in the number of respondents endorsing that statement. But then from 2017 onwards, there was a drop. And that is when Mo Salah joined Liverpool Football Club, the Salah Effect. So these findings indicate that positive exposure to outgroup role models can reveal new information that humanizes the outgroup at large. Right, almost done. Right, so the infiltration of Islamophobia in healthcare, the PREVENT strategy, one of the 4 strands of the British government's counter-terrorism strategy known as CONTEST, channel is a key element of PREVENT. And it's a multi-agency approach to identifying and providing support to individuals at risk of being drawn into terrorism. And did you know that the UK is the only country in the world where it is expected of a healthcare system to screen for radicalization. We are. So this is a really interesting report conducted by academics at Warwick University. And they recruited 329 NHS staff to complete a survey. And 2/3 of NHS prevent referrals come from mental health trusts. So these are the results. 2/3 of respondents could not distinguish between someone who was radicalized from someone with an interest in Middle Eastern politics. Isn't that astonishing? And patients were being referred to prevent for going on pilgrimage to Mecca or watching Arabic TV. You were being accused of being vulnerable to radicalization if you watched Arabic TV. The securitization of healthcare. So safeguarding has shifted from a welfare-oriented to a security-oriented endeavor. This is a surveillance rationale, not a safeguarding rationale. The Royal College of Psychiatrists have raised concerns, understandably, about PREVENT. And they focus on the variable quality of the evidence underpinning the strategy. There is no evidence. It's an example of policy-based evidence, not evidence-based policy. And you know, it operates in the pre-criminal space. Apparently, they say we operate in the pre-criminal space, PREVENT. And I mean, that sounds very kind of sci-fi to me. I don't know about you, but it sounds very kind of, you know, something that came from science fiction. That's because the term did come from science fiction. Can you believe it? These are terms, the term is being used in government reports, and it was first coined by the science fiction writer Philip K. Dick. I love the film. Don't get me wrong. I thought Minority Report was a fantastic film. But as I said, it does sound like the term comes from science fiction. That's because it did come from science fiction. And this is an article published in the British Journal of Psychiatry, all about where the term came from and why it's problematic. So these are kind of multiple repeatable organizations, such as the United Nations. They have raised concerns about the PREVENT program and how it violates the human rights of people. This is our college president in an article entitled, "I'm a doctor, not a counter-terrorism operative. Let me do my job." This is a very chilling statement to conclude his article. Rather than preventing terrorist attacks, I feel that PREVENT measures at best do little more than prevent people from seeking support for serious illness. The barriers for people from BAME backgrounds to mental health care services are formidable enough. And we've just fortified those barriers. We've fortified that fortress. We're supposed to be breaking down the barriers to mental health care, and instead we fortified them with the PREVENT program. So this is a really interesting report that was released recently from the global health charity MedAct on the ethics of the vulnerability support hubs. So these are counter-terrorism police for mental health settings where individuals suspected of being vulnerable to radicalization are referred to for treatment. And the scheme is currently being rolled out nationwide by the police via Project Cicero. I don't know if I said that correctly, but despite lack of independent evaluation and public scrutiny. And the report revealed that racialized Muslims are 22 times more likely to be referred to the vulnerability support hub for suspected vulnerability towards Islamism than white British are for far-right extremism. Isn't that just, I was like flabbergasted when I saw that, speechless. And so the authors of this report from MedAct reported the focus of the vulnerability support hub is for the benefit of counterterrorism policing rather than for the benefit of patients. What's going on? The securitization of health. And the assessments are being conducted in the presence of police. And there's also intensified monitoring of adherence with prescribed psychotropic medication for reasons such as converting to Islam, and concerns that police are pressurizing professionals to detain individuals under the Mental Health Act. So VSH blurs the boundaries between security and care. The definition of extremism could be extended to encompass those who object to certain aspects of UK foreign policy. Also, for example, with the horrific events that have been unfolding in the Holy Land, in Gaza. If you are pro-Palestine, did you know that there have been increased referrals of children? And the majority of people who refer to the vulnerability support hubs are adolescents. Children as young as 6 were being referred to these hubs. And children vocalizing pro-Palestine support were being referred to these hubs. The pathologization of political expression, the stigmatization of people with mental health difficulties, identification of a mentally ill patient as a terrorist may further exacerbate the stigma attached to mental illness. So these are some of the take-home messages. I think we did overrun. Oh, did we? Only by about 5 minutes? Is that okay? What's 5 minutes, friend?
That's all right.
Is that okay?
Yeah.
So Islamophobia is a pervasive phenomenon with social, economic, and political factors contributing to its rise in the West. And it's associated with psychological distress not only in Muslims, but those perceived as Muslim. Loopholes in the legislation allow Islamophobia to flourish. And this has adverse effects on mental health and psychological well-being. And the British government's prevent strategy and the vulnerable support hubs may be added barriers to mental health services for Muslims with mental illness in the UK. That is a wrap. We're not doing Q&A now, are we? Or
I mean, we can ask one of the questions if you've got time.
Yeah. What's one of the questions? I can't see it. Can you read it out? Is that okay? Sorry?
Yeah. So it says, may I know your thoughts on intergroup bias on service users and clinicians, especially in psychological services? I recently finished a dissertation researching the intergroup bias, Asian and non-Asians, on mental health perception, and the results suggested that there may be greater bias in group, but past studies have always supported that there will be more serve out group bias in everyday life.
Wow. Well, the person who has asked that question, thank you for asking it. I suspect you know more about that kind of area than I do. If you just completed, did you complete a dissertation or a thesis?
Yeah, I think it was a final year psychology dissertation.
Okay, yeah. Please do disseminate. That dissertation, because I would love to know the findings and what's kind of details in that report. I think. And thank you, Julian. Julian is such a legend. I miss you, man. I hope you don't mind my saying. It's been ages since I last saw you. Julian is such a legend.
Yes, he is.
He is. Everyone loves Julian. So I was going to say, yeah, I mean, race is, it's a huge problem, isn't it? I mentioned that a psychiatrist from a BAME background, 6 out of 10 of us, according to an RC Psych survey, report that we've experienced racism. And there's something called a colorblind. It's a term that my friend uses. By the way, the expert on Islamophobia in the NHS is Dr. Tariq Yunus, and I would highly recommend that you read whatever he writes, because the man is just genius, and his heart is in the right place as well. So there's something called colorblind. I think performative colorblindness. I think that's the term that he uses. And essentially, that's when we say that there's no such thing as racism in these referrals to prevent, and that's not evidence-based. That's not substantiated, because by denying racism exists, we perpetuate it. So it's something called, like, racism in a post-racial world. We're saying that we live in a post-racial world, but that's not the reality. The reality is that actually, as you can see, I mean, the evidence is clear for everyone to see. Look what's happening in, the Black Lives Matter movement. The death of George Floyd. So, and it's a difficult topic to talk about, I think, for many people, because it can elicit um, passion, and strong feelings and emotions. But we need to talk about it, otherwise it will continue. It will continue to exist. So, a credit to you, Tori and Educate. Thank you for inviting me. And stay connected on Twitter, on YouTube, and send me an email.
Yeah, I was going to say thank you so much, and just comment that it was amazing, very moving and informative, and you didn't break the first rule. Don't know if
which is don't talk about Fight Club.
Yeah, and then that was really insightful and eye-opening. Thank you so much. Yeah, thank you so much. And how many followers is it on Twitter now?
Oh, I don't know. You tell me.
I don't know. It's a lot. It's so feel free to follow him. And I was just going to mention, here is a link for any UEA students to where you can report any hate crime, racism, harassment, bullying, everything like that, because I thought it was kind of important to kind of add that in here. I am trying to put my camera on, but it's not working right now. But I'm going to get that sorted at some point. But thank you so much, Dr. Hankir, for joining us today. Again, I would love to have you back again, as always.
As I said, you're very welcome, sir. I'm a huge fan of Educate, so I would be delighted to return. Hopefully next time face to face.
Yeah, definitely. Thank you so much.